Hi everyone, and welcome back for yet another episode of Circling the Rabbit Hole podcast with me, Dr. Claire Kinuthia. I'm really excited to be back. I've enjoyed the engagement with you guys so far. All the DMs and the emails, please keep them coming. It's really encouraging. The feedback, the fact that a lot of these stories are resonating with you and that there's a lot that you're learning from the episodes. I'm really appreciative of that. However, I have since learned that I have to ask you out loud to please subscribe to the channel on YouTube, on Spotify, and on any other platform that you enjoy your podcasts. It helps a lot. It keeps these episodes coming. So I look forward to seeing you hit that subscribe button. So today we're having a bit more of a medical conversation. We're going to talk about medical issues that affect specifically women in this scenario. And I think my guest today is the person who instigated this conversation. She had a full calling out on Instagram. It was Instagram, right? Yeah. She called me out. I was summoned. And so that's why we're here. I'm here with Dr. Hope. Really excited to have you on set. Thank you so much for joining me today. I feel like we're going to learn a lot.
I hope so.
About a conversation, a topic that people don't really talk about, actually. If anything, it's one of those things that's been minimized, especially when it comes, it's a common thing we see with women's health. You get a lot of minimization of the issues that women suffer. And this is one of those very common ones. So I'm excited to have you here. I will start in simple fashion. As always, please tell us a little bit about yourself and what you do, and then as well where we can find you on social media.
Okay. Thank you for that lovely introduction. So as you mentioned, my name is Dr. Hope Simiyu. On Instagram, I still go by Dr. Hope Simiyu.
Also, the way you spell
there's a story to it.
Yeah, because I want to know. Because the first time I read it, I was like, I can't believe this is actually Simiyu.
So what happened was in primary, I had an English teacher who was always like, Simiyu all the time. Okay. And it just stuck.
Right.
Yeah. So I was like, let me just use it.
And you know, for the longest time, I hadn't clocked it. And then when I finally
people
did,
haven't.
It's like,
Yeah, many people
Right.
haven't.
Yeah.
So like when I joined Instagram, like I was trying to be fun because it wasn't that serious.
Yeah.
No, people are just like, use your government names. I'm like, hey, calm down.
Okay.
But yeah, Simiyu is Simiyu.
Right.
Yes.
Okay.
So I am a medical doctor by profession, in case hujui already. And I work in the non-clinical space, focusing on chronic disease management and wellness.
Okay.
Yes.
Okay.
Then outside that, that's like 8 to 5.
Okay.
So after hours.
Yeah, after hours.
After hours, I'm told I am a shouter, but I'm just a health advocate.
I do agree, though. And I'm here for it. For all the noise that you're making
like,
online.
Why are you shouting at us? I'm like, I'm telling you politely.
But
it's
loud
just
enough
my
for you
voice.
to hear.
Yeah. So I do health promotion.
Right.
And I'm really passionate about health advocacy and policy. So as I say, I'm here for a healthier you.
Right.
Yeah. So that's my goal. I just want to make patients informed because there's some things that you can actually do for yourself even before you seek healthcare.
True.
And I found that people really don't know.
Yeah.
It's like you just let health happen to you and you're not as proactive.
True.
Yeah. So I'm just trying to get people a bit more proactive when it comes to their health because I think outcomes are better and also it's cheaper.
True.
In the long run.
Again, we keep forgetting that there is preventative medicine.
Yes.
Like there's both prevention and cure.
Yeah.
So we want you to focus on preventing the illness rather than waiting to be sick to come in to see us.
Yeah.
So
and
I like
when
that.
you're sick, you come early.
Early, please. Yeah, because we know the culture in this country.
Yes.
So where can we find you on social media?
Oh, you can find me on Instagram as Dr. Hope Simiyu. I think you'll put it somewhere here.
Yes.
Maybe those people.
Over there.
And the same name on TikTok.
Right.
Then I also have a channel with some Wait. Hey, don't even cut it. Just leave it in there. With some lovely lady doctors. It's called Random Doctor Talks.
Right.
So we also talk about all things medicine and all things life.
Okay.
Yeah.
So I will put everything in the description box.
Yes.
So you guys look out for that and look for her. She does shout. She calls you out on all the things you're not doing or all the things you're doing right. She's also good. You call out people to keep doing the right thing as well. Yeah. So we're glad with that.
Yeah.
Hiya, on to today's business. You shouted.
Yeah.
You shouted, I came running. In keeping with what you do, you shouted. I just found myself summoned on Instagram. Tell us a little bit about what was happening so that we get to how we got here.
So, have you ever had those days at work where you came in, you were fresh, you were happy, the day was moving on nicely, and then they say Gafla bin vu. All of a sudden, you're angry, you're in some funk of a mood, and you start feeling sick.
Right.
Yeah, so I was just like, isn't it Gani Sasa? Like, what is this?
I started my day well.
Yeah.
No one has pissed me off.
And it's like a switch. Yeah. It's just like on, off, like that. Yeah. So I was talking basically about PMDD and Premenstrual Dysphoric Disorder.
Yeah.
And it's something that I feel like I've been going through. Maybe you'll diagnose it, but I feel like I've been going through.
Right.
And it's like it keeps becoming more and more and more.
Right.
So it's just like, hey, the gynecologists, please. Hey, help us. Because it's like please. We can't work. You literally feel sick.
Right.
Yeah. And I was like, hey, this is too much.
Yeah. And everybody's annoying suddenly. Nothing is working.
Exactly.
Then talk about the cravings.
Yeah.
Suddenly you want to eat.
Not even the cravings.
You've really documented
the
for us.
Fatigue. Let me tell you, the fatigue is on another level.
True.
I have never been pregnant, but if people say pregnancy makes you tired, hey.
If this is a sign, if this is a small fraction.
God, I am not your toughest soldier. But so I just wanted us to talk about like PMDD and also PMS as well.
Yeah.
And just to see what can we do for ourselves.
Right.
And also like what professional help can we seek if it's becoming a bit too much.
Yeah.
Yeah.
Right. And that just sort of brings us full circle. We fully understand how we got here and the conversation we're about to have. But I have a fun plot twist because given her vast experience as a noisemaker and a shouter, I felt like Dr. Hope is the best person to have as my first guest host on the podcast. And then I find myself automatically in the awkward position of being my own guest.
Yes.
But for this conversation, I think it's only befitting, given that you're coming from a point of experience, and then I'm coming from the point of the sort of expert opinion, that you get to ask me, pick my brain about PMS and PMDD, and that's what's happening next, guys. So if this sounds confusing, please, I am now the guest officially. So over to you, Dr. Hope.
Thank you. So guys, welcome back to my show. I dressed the part. But first of all, how does it feel to be a guest?
Let me tell you. I've suddenly started sweating automatically. I'm like, no wonder guys feel like I've put them in the hot seat.
You're in the hot seat, yeah. No, don't worry. The questions are polite. Yeah, they are. Yeah. Okay. So I'll just go question by question, and where you need me to repeat the question, feel free to ask.
I love how you're managing me.
I'm managing you on your side.
Right, okay.
Yeah.
Okay.
So before we even move forward, first of all, could you define for us PMS and PMDD?
Okay.
Yeah.
So PMS or Premenstrual Syndrome is just simply basically what it sounds like. It's premenstrual, which is before your period. So there are signs and symptoms that start just before your period, usually a week or 2 weeks before your period, depending on how long your cycle is. For some women, it's a bit shorter, so it's a few days to your period. For some, it's a little bit longer. But it tends to be physical as well as emotional symptoms. And for PMS specifically, they're milder. They're not as crazy as it gets with PMDD, which I'll get into next. But for PMS specifically, you start to notice like physical symptoms like breast tenderness, the fatigue you were talking about, brain fog or being unable to concentrate. Some people become, you get like joint pain or muscle pain or bone pain. You just have aches and pains. You're sort of like feverish and you don't understand what's going on, but you're not unwell. Like you said, you can start your day completely normal, and then halfway through or in the middle of the night, suddenly you feel different.
Halftime, guys. You're like halftime.
Yeah, and it's just a mess. It's a complete mess. And you're like, what happened? I was fine in the morning. And then, so it's physical symptoms as well as emotional symptoms. So irritability, feeling sad, feeling like you want to cry. That's the most common thing women will talk about. I just feel like I just want to cry. I have no reason. I was fine. I thought I was a normal emotional person, but suddenly now I'm like, what's going on? I'm very teary. For others, there's anxiety or like a sense of lack of control, or you don't feel like you are in control of yourself or your surroundings. And again, for PMS specifically, these symptoms tend to be manageable, much easier than when we start to get into the spectrum of PMDD.
Okay.
Yeah. Yeah.
Okay. So what would PMDD be? I think you've talked about PMS.
PMDD, surprisingly, is actually considered a mental health condition. It's actually...
For real?
Yeah, it's in the DSM-5. Yeah, it's crazy. So when we say we minimize women's symptoms, this is where the biggest challenge is, because this is actually something that's defined and classified as a depressive disorder in the DSM-5. DSM being the Diagnostic and Statistical Manual of Mental... of something. She said to you.
Manual or something.
I'm like, I'm turning into a teacher here. Wait. Bad student.
Go on.
So it's the manual that basically psychiatrists use to make a diagnosis. So it gives us diagnostic criteria. And right now, as of 2013, I believe, PMDD was classified there.
Okay.
Yeah, and PMDD is Premenstrual Dysphoric Disorder. And dysphoric is actually a mental health term that we use. So it's not as simple as I feel sad, I feel, teary, it's actually now takes it into this person actually demonstrates symptoms of major depression, of anxiety. Some actually lean towards complete loss of control with relationships, because it really does affect how you relate with other people. Yeah. Some people have described having suicidal ideations. So it's quite extreme. It's not as simple as, I can manage this over the counter. You actually go from, and the key of the criteria is this is, again, just before your period. And then after or as your period is progressing, the symptoms start to disappear. So if you don't understand what's happening, you can actually think you're crazy. Yeah. Because
yes,
1 minute you're fine.
Yeah.
Next thing, you're so depressed or you're so sad or you're feeling, I'm going to end my life. And it just doesn't make sense. So it's important for us to mention today, it's not as simple as these are just simple symptoms you get with your period. It's actually a mental health condition that needs to be diagnosed appropriately and a lot of the times managed appropriately.
Okay.
Yeah.
Is there a difference in like the timelines? Like, how, depression and anxiety, they say you've had these symptoms for more days than less for a certain time period. Yeah. Is there a time frame for PMS versus PMDD?
So for both PMS and PMDD, they're linked to where you are in your cycle.
Okay.
And that's what differentiates them from major depression, anxiety, bipolar disorder, all these other mental health conditions. Here specifically, your symptoms happen just as you're coming towards your period. So between ovulation and your period. So some women, it's a few days, some it's a week, some it's 2 weeks to your period. And that's the classification to say this is PMDD as opposed to depression and anxiety.
Okay. Nice. Do you mind giving us some signs and symptoms of PMS and PMDD?
Yeah, so like we said, PMS tends to be, both of them have physical as well as emotional aspects. So things like breast tenderness and swelling, bloating, change in your appetite. You either want to eat more or less. Sometimes it's more a craving type of thing. So there's a very specific craving that you get just before your period. And then after your period completely disappears.
Pause there. What's your craving? Mine is sugar.
Really?
Sweet.
Yeah, mine is chocolate.
For
specifically real? Chocolate, not just sugar.
My sugar, paste. Okay, I'm not even a fan of chocolate.
Yeah.
Sorry, but like pastries.
Yeah.
Like those Kafo cookies have me on a chokehold, by the way.
We have seen. As your audience, we have
I'm
seen.
sharing too much. But those cookies and like the Art Cafe pastries, oh my goodness.
Right. Yeah, so I'm not even a sweet tooth to begin with. So even the chocolate thing catches me off. I'm like, but why?
You're like, but
also
you know why?
Then you think about it, I check my app and makes sense.
Okay.
And it's really like severe enough that sometimes I'll sit with a bar and that's it. That's lunch and I'm done.
That's it.
So it can be...
That's lunch.
That's lunch. I'm not interested in any other food type. Don't feed me anything else. This bar of chocolate.
And that's it.
So
that's girl dinner and girl lunch.
Right. That's when you know, okay, this is just not me.
Yeah.
So in things like that, you can have physical changes. And again, if you're not eating right, it tends to, as we'll talk about it later, it worsens the symptoms of PMS. So some of these cravings, like excessive sugar and fats and highly processed foods, because then a lot of people will say, I have KFC at that time only. That's the only time I have that craving. If that's the case, then you know it's more likely PMS or PMDD, depending on the severity, because the difference between the two basically is severity. And then emotional symptoms, like we mentioned, where you're tired, but either you're not sleeping at all or you're sleeping excessively. That's another thing that you'll find. extreme fatigue, lethargy, where you just don't have the energy to do your normal day activities. And then emotionally, you're so erratic to the point where in PMS, it can be managed. You're able to sort of understand this is where I'm in my cycle, and you can use different types of exercises and different over-the-counter management, basically, and you get the symptoms under control. But with PMDD, you actually need help, because you can get so depressed or so anxious that you can't function. You can't leave your house. You can't relate normally with the people that you have in your life. And now we start to know that this is not normal. Yeah. So those are the more common things. Some women will experience things like nausea. Like I said, weight will change depending, again. And then it also depends on whether you also have long-term medical issues. So we find that PMS and PMDD, the people who suffer from symptoms, especially as we go towards PMDD, tend to be that they're more sensitive, or their bodies react differently to the normal changes of hormones. So when we see estrogen and progesterone, how they play with the menstrual cycle, when you come into your phase where ovulation has happened, estrogen is starting to drop, progesterone is starting to go up, and then just before your period, progesterone drops again. They play that dance. I'm sure you're the wrong student. I'm not even going to quiz you. But those changes, some women's bodies, there's their propensity to be more sensitive or to react worse to those changes. And that's what causes the symptoms. However, if you already have a diagnosis like depression or anxiety, or you're on medication for other mental health conditions, you're more susceptible to exacerbations of symptoms just before your period. So you feel like you've been managed, you and your psychiatrist have managed on your medications, you're well balanced, but there are certain times of your cycle where your symptoms are just very severe. That's probably what's going on.
So would they call it like a trigger?
It can be. It can be. But then for us now as the doctors, it's our job to differentiate between something that's a long-term medical condition versus this one that we have to manage cyclically.
Okay.
Yeah.
Now, sorry, you've talked about PMS and how PMS can actually progress into PMDD.
Yeah.
So before you even move there, how do you diagnose? I think PMS is a bit easier to diagnose, but how do you diagnose PMDD, and how do you know that now PMS is escalating and has become PMDD?
Yeah. Again, it's about severity.
Okay.
Because PMS, majority of symptoms are manageable by yourself. Like you learn, when I'm feeling like this, I just need to take a walk. I need to exercise. It'll lift my mood. I need to eat a certain way and I feel better. I need painkillers over the counter and I'm okay. Like the symptoms just go away with manageable approach. A hot water bottle, a nice hot bath, and you chill and you feel better. And then PMDD, you've done all these things and you're just spiraling out of control. So that's the major difference. And it's very hard sometimes to even tell that you're progressing, because for you, you're living in the experience. So like your description, back in the day, it was manageable. You barely notice. It's a day or two. As we continue with time, it's now a week. It's getting worse. It's interfering with how I work. It's interfering with how I relate with people. And as you come out of it at the end, because when your period starts and its symptoms start to reduce, you actually ask yourself, okay, what just happened? Because then you're a completely different person again. So over time, you start to think, am I bipolar, or is there something else going on with me? Do we have multiple personalities? Like, you can really be thrown off. And it's important to understand that, again, we keep minimizing symptoms for women, and yet it could actually be that this person is in true crisis.
That's true.
So we have to remember that if your symptoms are really bad, if it's getting to a point where you feel, no, this is not okay, this is not normal, and you know it internally, it's not something someone else has to tell you. If you start to get to that phase, you need to come in for help.
Okay.
So in terms of making a diagnosis, again, like I said, there's diagnostic criteria that this is where the question comes in. Who do you see if that's how you're feeling?
That's true.
Yeah. So do you come to your gynecologist? Do you go to a psychiatrist? Like, what happens? Again, because it's period related, most people come in to see us, the gynaes. And it's our job then to start to differentiate between milder symptoms versus severe. And once we are clearer on a diagnosis, if we're thinking about PMDD, we rope in a psychiatrist. Sometimes also psychologists, because therapy will go a long way as part of treatment. So it's a team. Your doctor will create a team around you, and that's what will help with the management. For some people, we're able to use behavioral changes, lifestyle modification, and that helps the symptoms. For some, we actually have to go on medication.
That's interesting. Yeah, you know that's the meme for Spider-Man, and they're pointing at each other. Like, who do I go to?
Who do I go to? Where am I supposed to?
Yeah.
And then again, it's difficult to imagine that you would think to go to a psychiatrist because of your period, like because of symptoms that only happen around a certain time of your cycle.
That's true.
And then also, we are assuming the person has recognized that there's a cycle, because you just feel sad. You just feel hopeless. You just feel, so you're not relating it to your period necessarily. So again, diagnosis is teamwork. So a lot of times we'll ask you to track your cycle and track your symptoms so that we see if there's a pattern. Because strictly speaking, PMDD has to be cyclically related, same as PMS. If it's lasting longer, like for depression, if it's more than 2 weeks, you're just feeling hopeless and sad and you can't come out of that funk, then more likely than not, we're going to go towards a different diagnosis. Yeah.
Maybe let me just give them the backstory, because I know we've talked about progression, but sometimes people might not understand that progression can be even like 10 years.
Yeah.
So like for me, we were talking about this earlier. For me, when I started my period, it was so nice. Like, what are cramps? I don't know. It's
what
like 2 days, 3 days.
Say?
I'm like, I'm good. I'm okay. And that was like high school, Then you go into uni, and I started getting now PMS. So I would have like 1 or 2 days before my period where I would be so irritable. Like, that one for, why are you breathing in my space?
Why are you
Move,
even here?
Get out.
Competing for oxygen.
Imagine. And I'm suffering.
Why?
So like even my friends would know, it's close. Any day now. And I think I can attribute that to like some of the stressors that you have, like when you're going through, like med school is heavy.
Med school.
Ooh. That's a story for another day.
We'll have a therapy session between the two of us.
My goodness. Then when I now went for internship, which is like, let me say 3 years later, since I started now having PMS symptoms. Now it started lasting for longer. So I'd get like now like very sad. I'd get very irritable, just tired. And it's those things where like, I don't feel like leaving bed today. And inside you're just like, I know I can manage it, but I just feel like staying in bed. Then as now the years have progressed, I'm like, now I feel sick. Like, nasikia malaria. Like, for real, why am I climbing the stairs and I'm panting?
And you're panting. And normally, you're fit, you've been active.
Okay, fine, I'm not fit. I try my best. We're getting there.
I was trying not to throw you under the bus. I was doing my best here.
We're getting there. So like, it's just getting worse and worse. And the physical symptoms are increasing, but also the intensity of the emotional symptoms are now becoming like a lot. So that was like my progression. So it didn't happen like overnight. It's like since I started and then where I am now.
And it's important also to note that some of these changes are also expected, because your cycle may not look the same throughout your reproductive years. It's another thing we don't talk about, that how your period was as a teenager will change in your 20s, will change in your 30s, will change after children. Like you're in constant.
To change after children, please say for the better.
It depends if you're lucky. But that's the reality. You don't have a static body. You don't have. You can't expect that the way you used to eat as a broke med student versus how you're eating now, not the same. And so your body will also adjust and change. So some of the symptoms may be considered within the normal realm, but then others will be so extreme that okay, this is not me. There's something different here. And again, I'll always like reach out, because I have sort of half and half of an audience on this podcast. So a lot of the audience who are medics and doctors, I always encourage you, please believe your patient. Like, just believe what you're being told. It's not something for you to brush off or assume, because that's one thing we're very guilty of.
That's true.
Is because if I don't understand what's happening, then I just say, listen,
it's not happening.
It's not happening. Let's just you're Delulu. Walk out of my office.
Find
now.
your solution.
Walk out now. Do you know there are sick people waiting for me?
And you're doing hapakule over here.
Right? So it's better to believe. Because again, it's your body. You know exactly how, like for you, you know how it's been changing over time. So if I don't believe it, as who also? That's true. Becomes the question. True. So it's important for us to believe our patients and then start the process of tracking to see, is this actually PMDD or is it a bigger issue? And then we're able to manage appropriately.
Okay. Then there's another question that you'll see, I'm sure you've heard of this a lot, is many people don't really believe in like mental health conditions. And now we've added PMDD to the spectrum again.
You're adding womanhood,
Imagine.
periods to this mix.
So, in your opinion, could you help me demystify that this is actually a real thing? It happens. And there are very many women who have been affected by it, and some might not know.
Yeah.
Yeah. So, in your own opinion, your own words, try and help us demystify it.
Again, just especially if you are more self-aware, you will know when things are changing. You will know what your normal has been, and then now I'm changing. And is this change manageable or not? Am I feeling like I'm completely out of control versus where, yes, I used to feel sad. Yes, I feel like I want to cry. I have a good cry one night. The next day I'm back to normal. My period starts and life continues.
Did you used to have the cries at midnight?
Oh, listen, in the middle of the third bar of chocolate.
It's always midnight.
Because then you're judging. On top of everything else, I'm judging myself for how much chocolate can one human eat. This is not healthy.
Yeah.
Like, okay, we will feel the calories and the weight come on later. And then that'll worsen the situation, because then you enter this weird cycle of, okay, now I'm beating myself down because I keep indulging in cravings and stuff. But yeah, you can get really, really teary, emotional. It tends to happen around midnight, because now that's when you're shutting down, the world is off, everyone is gone to bed, you're quiet. Or worst case scenario for us, you're on a night shift by yourself. It's been a rough one so far.
Speak for yourself. Hey, speak for yourself.
I'm taking you back in the day when you were on the ground. Ukiwa kwa ground. So yeah, those changes can be quite extreme. Yeah. And the thing is, again, listen to your body, start tracking. That's the thing I'll ask, especially now. We have so much technology at our hands. We have apps that you can use to monitor your period. So you can start tracking, and especially certain apps that also track moods, and they'll track physical symptoms. So as you're saying, I'm here, ovulation, I have pain, or I had a bit of spotting. Some women have those symptoms, others you don't have anything. Then you start to notice, I'm feeling sad today, I don't have energy today. There are apps that actually help you track. And then if you look back 1 or 2 or 3 cycles, you'll notice, okay, hang on, I have a pattern here. These symptoms are only problematic around the time of my period. Afterwards, I'm back to, in fact, I even forget I have an app. I forget to track anything. You're not even interested anymore. But during that time, it can get pretty intense. Yeah. So the thing is, believe yourself first. Let me give the patients or women out there permission. Believe yourself. If something doesn't feel right, start to monitor. Because again, I understand, like I said, some of us, the problem is the medics, and we don't want to believe the patient when they come in. But if you have evidence, if you come and show me, I have been tracking my period, okay?
You can't deny.
The last 6 months, look at what has been happening. Yeah. We can then sit down and have a different conversation, because then even you have evidence that's telling you there's something different here. And once that has happened, we are able to now manage whatever it is we are facing. We're able to make a diagnosis, and then we put you on the appropriate management.
That's actually quite true.
Yeah.
Is there a specific test? I know you mentioned hormonal changes, and then also because it affects your brain, like, you know, the brain chemicals, there's some changes also that happen. Yeah. Are there specific tests you can do to either diagnose?
So again, unfortunately, with like mental health conditions in general, the diagnosis tends to be tools rather than tests, or rather we call the tests tools, because then it's like a questionnaire. It's like what I'm talking about, tracking with your cycle, just monitoring what the symptoms exactly are, so that you're able to describe, I feel really anxious, I'm feeling frightened, I'm feeling out of control, like I don't have control over my situation. Or you're feeling really sad, you feel really dark, you don't know how to integrate in community anymore. Everybody around you pisses you off. It doesn't matter what they do. The guy so much as honks a horn at you. That's it. Road rage queen. Like, it becomes very, very intense symptoms. And now from there you sort of know, okay, there's a problem here. But for us, in terms of the medics, there's diagnostic tools and criteria that you need to meet. For PMDD specifically, we need at least one major emotional symptom, so like depression or anxiety, either hyper sleeping or insomnia. Like I'm really trying not to use jargon. That's what's happening. I'm like, English words.
I know you know the word.
English words. I'm like, translate, because
excessive sleeping.
Excessive sleeping or not sleeping at all. And then, so we need one of those major emotional or mood changes. And then on top of that, we add on, because in total we need 5 symptoms. So then now we add on other minor symptoms or physical symptoms come in as well. And then the pattern that it's happening at that time of your cycle, so between ovulation and your period. And then finally, it's a diagnosis of exclusion generally. Okay. So we rule out other medical issues. So we look out for hormonal issues like hyper or hypothyroidism, because those can also affect the way your body is and the way your mind behaves. We rule out now other psychological issues as well. So we're ruling out depression, mood disorders, personality disorders. So it's a work in progress. And again, teamwork makes it easier and faster.
That's true.
So the gynecologist tends to work with a psychologist and a psychiatrist, because again, a lot of this needs medical management.
So you'll do one part and then they'll do the other part.
So we create a team around you, and we come up with a diagnosis, and once we have a diagnosis, sort of help you understand and accept that this is what the diagnosis is, because also it's one of those where like what are you saying? No. Are you saying that my body does not like my hormones? Make that make sense.
And then it makes me a bit crazy. Like a bit.
It's sending me over. So it's also something we have to guide and help you accept and understand the diagnosis, and then discuss management options. So
then I know we haven't actually talked about an actual cause. Is there an actual proven scientific cause for PMS, for PMDD?
Unfortunately not. Imagine
it's not even unfortunate. I feel like there's so many medical conditions where just like we don't know the cause.
Listen, we've only just given it a name. We've only just started to accept that this is a medical condition, because like I said, again, a lot of issues we see with women's health, it's rubbished, it's pushed under the rug. We don't want to discuss it. We want to act like it's not real. So just the fact that we've gotten to a point where we're like, this is an actual medical condition, this is something that needs medical support and therapy, that's already a big step. Now that it's been classified, there's a lot of research ongoing to now try and fully understand why are some people more susceptible, why are others don't have symptoms at all. There are women who don't know what PMS is at all. Then there's those with mild symptoms, and then now we have patients with PMDD.
Okay. Who's doing the research? Me can be patient 0 at a fee. Or patient 15. Then, so when should someone seek like professional advice or attention?
Again, because you know yourself, when you know this is not something that's okay. This is not my normal, despite simple steps I've taken to try and manage my symptoms, or maybe I have been managing, and now despite what we were doing before, now my symptoms are much worse. That's where you need to come in. Sometimes it can be so severe that the patient isn't aware. Because again, insight is another thing that mental health conditions a lot of them are not associated with insight. Insight meaning I'm aware of what's happening to me. I'm aware that what's happening to me is not normal. In such situations, then the people around you have the ability to say, okay, this person is not okay. And especially so when it's so severe that either you're more prone to accidents or you're having suicidal ideations, then it helps that the community around you steps in and brings you in for a review.
Okay. Then another question. This is for us who are in the working field. What can people, your community, your environment, and your workspace do to like try and just accommodate some of the challenges like PMS and PMDD for the ladies? Because of course we have many lady employees and employers. So how can we support them even as they go through such painful,
that's a big question.
Situations?
That's a big question, because do we even support women in pregnancy, let alone in this thing that we are not seeing?
Let me tell you, I have a friend who actually posted today that her company, they were reviewing the maternity leave policy, and it was now 6 months. I'm like, 6 months? Where is that? I need to go and work there. She's like, they're reducing it from 9 months. I'm like, what, they're reducing it?
So
like, wow, it's true.
It's very difficult to find gracious employment that will factor in your physical and mental health issues in general, let alone the ones that are specifically affecting women. The thing I'd encourage is, again, believe people. Again, a lot of women who have very severe symptoms have also learned how to manage themselves. So you know when you're really productive, you go all out. And then when you're not, you sort of slow down. So maybe some of these things can be incorporated into the work cycles, where it's harder to do, of course, but on a one-to-one basis, if I understand that you're better at certain times of the cycle, I give you the grace to, this is the workload, this is what you need to achieve. I don't need to micromanage how you're doing it every single day. So that on the day where you can't step up and match the same energy, at least we are still on track. Because the days where you're, at your best possible capacity, you're able to do the work. It will take a lot, I think, for employers to get to a place. Because also when you think about it, how do I manage the workplace for so many female employees who are on different cycles?
Yeah, that's true.
But again, if you wanted to, you can find a way to manage and help people accommodate a bit more. The day where she really just can't get out of bed, let's just understand.
And that's the thing. It's
Let
the
her
day.
Work from home. It's a day.
Not the whole
exactly.
period.
It's not
just
a whole
the day
thing.
or two.
Exactly.
Yeah.
The same with women who struggle with like really severe period pain or very heavy flow and stuff like that. We can accommodate because it's not every single day.
That's true.
There's just a few days where I just, listen, I can work from home. Let me work from home.
Even that one day you'll appreciate.
Yeah. And it'll make a difference because you feel supported. You actually still can be productive because I don't know about you, but me, I work fantastically in bed.
Even me, let me tell you, I did med school in bed.
Right?
That was my reading. That was my desk.
Yeah, you study in the comfort of your bed, at least because it's keeping you going. And
It's true.
Even as everything else sucks, at least I'm comfortable. As I
Like
cram
the pillow
nerves.
is soft. I'm warm.
Exactly. Yeah. So we can try to accommodate a little bit and it'll make a big difference because I think it will help us to be even more productive given that you're respecting the way your body behaves, you're understanding your cycle a bit better, you know when you're going to be super productive, you're really productive. The days where you need to slow down a bit, at least you're sort of matching the energy.
I think you've described work-life integration quite well because that's basically what it sounds like. There's some days you'll be at 100, the other days you'll be at 10, you know, and how do you balance that?
Yeah.
Let me just speak from my experience. So where I work, we actually have period leave.
Nice.
Yeah. It's
Nice.
one day,
Yeah.
like one day in the month where like your cycle is just like the worst.
Yeah.
So you can take period leave.
Right.
And it was actually something that was started by a former colleague of mine, a lady. She's just like, we need this.
Yeah,
Like it's
true.
actually very important. And it makes so much sense because
It
you just
does.
need just that one day where you're like, this is... I will be a terror if I'm at the office.
Exactly.
Like, let me just not be here. And I'll still put in the work, you know.
Yeah. And I think if you check, it makes you guys very productive.
It does.
If you think about it, and then you feel appreciated in the workplace.
It's true. Like, you see me.
It doesn't even take that much,
Yeah.
honestly. And a lot of the time, like you've said, it's not that you're going to be completely offline.
Yeah.
You're probably still able to work.
Yeah.
It's just that you're not making me have to
be
share
there when my
oxygen.
cramps are just...
Exactly. Yeah.
Okay. Then, let me read the last question.
I like how you came prepared.
In your opinion, kuna swali hapa. Is there medication that is specific for PMDD and PMS?
Yeah.
And do you advocate for
medication?
Yeah.
Yes, there's many, not just medication, but like lots of different lifestyle things you can do to change. So just starting from PMS, where we said the symptoms are a bit milder, home remedies like a warm bath, hot water bottle, painkillers, over-the-counter painkillers of all different descriptions. I don't need to go into detail here. You know what works for you. You and your doctor have tried a few things. So having those handy will make a difference for the physical symptoms especially. Where you can
Can
rest.
I stop you? Dr. Rina, I'm asking you as Dr. Rina. Actually, me, I feel like I went through a different obs guide, especially for like periods.
Right.
I didn't know ibuprofen is the recommended painkiller of choice.
It is actually.
I didn't
It
know.
works fantastically. Generally, NSAIDs, the non-steroidals, work really, really well for period pain.
Okay.
Yeah. So
We've just been cheated with Panadol and Buscopan.
It depends also.
On the severity,
some work for some women, some don't.
Yeah.
But generally speaking, ibuprofen will work across the board.
Okay.
Yeah.
Can I give you some feedback I got from like patients? First of all, every time I talk about a topic on social media, it'll always drive me back to pain management.
Yes.
Yeah. So I get a lot of, especially women, who say that we don't have very good pain management in this country. And someone actually talked about her experience when she had like really bad cramps. and she had to go to hospital and have the injections. And she's like, these people, they didn't want to inject me. They think I'm lying. They're just giving me an oral painkiller. So what is your take actually on pain management for some things like these conditions that we can't see? Like it's just it's like speculation.
Yeah. Again, my motto is believe your patient.
Yeah, please, louder. I think the people at the back need to hear. Yeah, because I'm tired of answering the questions.
Believe the person in front of you. Because if her experience has been, I need IVs to work. Again, I understand where medics are coming from. Sometimes someone is chasing narcotics, they're chasing a high. So you sort of have to evaluate and see, are you really sure? Because sometimes you'll say the only medicine that works for my pain is a narcotic. And the way we know how narcotics work, I'm like, that's a lie. We know that. However, I don't need to be abusive in the moment. Or dismissive. We can figure out how to manage. I have a lot of patients who come in and the only management they had before was IVs, and they have to come in monthly. And then we find things that work because it's about combinations. So you can have oral management in combination that works a bit better, and it's more... It gives you the freedom. You don't have to keep running into the emergency room every time your period comes. So be open on both sides. As the medics, listen to the patients. As the patients, be open to trying different things until we find something that works for you.
Okay. And you've talked about, gosh, it skipped my mind. I had a question. Wait. Oh yeah, sorry. So even this thing of believing the patient, I found that, especially in Mashinani, what happens when you ignore or neglect something that the patient is talking about, they'll go and do it themselves. So you'd find people who are just swallowing NSAIDs, and the effects of that.
Exactly.
So that's also another thing to think about when you're sending this patient home, because the patient will always solve pain.
Pain is the one thing. In fact, there are a lot of times we see people come in really late with some medical conditions because there was never pain. And then once pain is a factor, that's the thing that makes you come running. So believe, if I say pain is an issue for me, I need for you to believe me right off the bat. And then for me as well, be open to, because sometimes pain management is complex. It's not just painkillers. Sometimes we have to take other interventions to bring it under control. And then back to now, the medications we were talking about. I think we were talking about now, first of all, the lifestyle changes. So we find that in general, PMS and PMDD respond really, really well to exercise and dietary changes. So the healthier that you're eating, the less processed foods and less sugar and pastries.
But if that's what you're craving.
Again, if it's a craving and you're having it in the moment, that's fine.
Okay.
But then now it becomes,
Okay. Now you're saying like it's an everyday.
Now it's become a habit. It's just the way I eat. I'm just unhealthy in general. You will suffer more. And again, it's same with period pain. A lot of patients I see, I'll usually advise, let's modify your diet a bit. Let's take out some of the things that cause more inflammation in the body. And we find that their symptoms are actually more manageable, even without the pain management. So over time, you'll see a change if you're eating healthier. Exercise goes a long way, because the main thing about the brain and how it works with PMDD specifically, the happy hormone, serotonin, is reduced. For you, the way you respond to your hormones, serotonin is suppressed. And it's the feel-good hormone of the body and the brain. So when you have lower levels, you find that you're more sad, you're more depressed, you're more tired, the nausea kicks in, the body symptoms kick in. And what we can do naturally to improve your serotonin levels is exercise, because then you release endorphins and serotonin and dopamine and all these happy, feel-good hormones. So just naturally, you're already giving yourself the hormones that were being suppressed. So you'll find a huge improvement. And then, yes, there is medication, there's medical management. Again, once we've come to a diagnosis of PMDD, it's unlikely that just lifestyle changes or over-the-counter painkillers will be enough. Because now we're talking about an actual mental health condition. This is not just mild symptoms that I can manage. Here we tend to need to, and this is where we bring the psychiatrist in, we need to put you on an antidepressant. Selective serotonin reuptake inhibitors, SSRIs, are the best for PMDD. So we'll work with the psychiatrist and get you on the medication. We sort of have to play with doses initially and then finally find what works. I know a lot of women hear that I have to go on an antidepressant because of symptoms to do with my period, and they're like, what are you even saying? But unfortunately, we find quite a lot of relief, because we're talking about extreme symptoms. This is somebody who is leaning towards being suicidal. So it's not fun and games. We actually have to manage this as a medical condition. We also find some types of birth control, the combined oral contraceptive pills, some types, specific. It's specific to the type of progestin in that pill that actually relieves symptoms. Okay. So sometimes you'll find your doctor wants to put you on the pill to manage the symptoms, and then you feel a lot better. Sometimes you have to do the two in combination, the antidepressant as well as the combined oral contraceptive pill. Okay. And when I say believe your patients, sometimes it's so severe that we actually have to consider sending you into menopause.
What?
Sometimes symptoms can be so severe, we are in full crisis. And the only way we can salvage this person is to induce menopause medically. And then we do what we call add-back therapy. So we give you the estrogen and the progesterone in controlled amounts where we are able to manage how your body responds to the changes. Okay. So we do see sometimes, this is very extreme, where we are forced to do that. And then with add-back therapy, you're able to have as much of a normal life as possible. Then, of course, now once you're ready for babies and the likes, then we start to think about how to change back to normal.
Wow, I've learned that. I didn't know that.
Yeah. No, it's like honestly, when I say believe women, we're talking about something that can be very, very severe. And then, unfortunately, as we know, if you don't believe someone or someone doesn't even understand what's happening, coping mechanisms can actually be dangerous, because then you lean towards drugs, you lean towards alcohol, you go to recreational activities that are actually detrimental to your health in a trying to cope.
And they're temporary solutions.
Exactly. And then now on top of all the other symptoms you have, we're having to deal with an addiction. So you do have to really be careful. If you're feeling a certain way and you're just not sure what's happening, go in. Have a conversation with a doctor. Doctors, read. Let us educate ourselves around some of these medical conditions. Then that way you're able to step up for your patient before things get out of hand.
You see, I didn't want to speak about it.
This is where I was somewhere.
Wow. But now you've talked about coping mechanism. So what did you say for, you see the way we have high functioning and people with anxiety, high functioning people with depression. So what would you say to this person?
Again,
or what piece of advice would you give this person?
Acceptance of the diagnosis is key, because again, that's sometimes a bit of a stretch to tell somebody who is a high functioning corporate woman climbing up that ladder. She's a beast at everything she does. And now I'm telling her,
you're like, chill,
madam. You actually need medication to manage this, or we need a timeout and change in lifestyle. It's about just accepting. Sometimes, unfortunately, with chronic conditions, it's hard to accept the diagnosis, but once you do, you're able to just integrate the management into your lifestyle and actually manage things a lot better. And you function so much better in society. The one thing that you see immediately when we have a patient on the appropriate treatment is the recovery of their relationships. Because remember, the way you are around people during that time,
that is so true.
So sometimes you find that the one thing that we were able to salvage out of everything else is they're living a much more comfortable life, and they're able to integrate well with the community around them.
And that's what we're told is the aim of managing a patient for any condition.
Yes, exactly.
Okay. Now, as we wrap up, there's so many people who talk about having hormonal imbalances. Does this have an effect on PMDD, PMS?
It can do, but then the typical finding is that your cycle is normal. The majority of women who have very severe PMS, PMDD, their cycle, it's cyclical. So they have a very predictable cycle within the normal range, 21 days to 35 days, somewhere in between there. It's less likely for you to be able to call it PMDD if you're having irregular periods. It's very unlikely to even track, because then you may have symptoms, but because your period last came 3 months ago, you're not too sure if it's linked to the period. But in that scenario, you should be getting management for this irregular cycle.
So like, for instance, someone with PCOS, because that's one of the common things.
So with things like PCOS, the times that they'll notice if they have any PMS or PMDD like symptoms will be that one time where your period actually shows up. But again, a lot of patients with the PCOS have a period once every 6 months or once a year, or it's a very erratic cycle. So then how do you then match the two? And that's where we come in and say, okay, first of all, we should be managing the PCOS as it stands, and then we can be able to integrate and see now that you're on management. And again, you're unlikely to see symptoms because the management corrects the PMS and the PMDD.
That's
because
true.
So this is the thing with gynae work. Anything hormonal, once we manage the underlying issue, everything else sort of falls into place.
Okay.
Yeah.
Okay. Wow. Me, I'm still stuck on we'll put you slowly into menopause. I'm like,
that's in very extreme cases.
Yeah.
Though. Yeah, but there are people where we've been forced to do that, and then they recover pretty much fully.
Okay. Now, because you mentioned it, I have to ask, and this is like parting shot.
Okay.
You see that, of course, your cycle changes, and after you get or you've had a baby or a pregnancy, from your experience, how have people's cycles changed? Like, is it for the better? Is it for the worst? And I know you've had this thing that cramps improve. Yeah.
Again, there's no one size fits all.
Okay. But what's the majority?
At the point of practice where I'm at, I can't sit here and encourage you and say, but for the vast majority, I think it's more a brain thing. So the way people say cramps reduce or disappear after having a baby, I think the pain of labor recalibrates your tolerance.
Okay.
That's the most, when I've thought about it scientifically, I'm like, that's the most logical thing.
Yeah.
But it's unlikely that period pain will completely disappear or will change. There are a lot of women who come into a pregnancy and childbirth thinking my period will change, and then when it comes back, we're back to where we were. And especially so if you have an underlying medical condition. So patients with things like endometriosis, for example, symptoms will almost completely disappear during pregnancy. And then once you're back to your regular cycles postpartum, a short while later, you find, I'm back
again
to where we were.
Like you never left.
What happened, Daktari? I was expecting a miracle recovery. And unfortunately, that's not the case.
Yeah.
So again, it's not one size fits all. The lucky ones, everything settles, the period is manageable, it's shorter, pain disappears. And then there are those where it's business as usual, unfortunately.
But then I feel like I don't even have cramps. When I hear some people's experiences, I'm like, like, guys, sorry. Like, what?
Exactly.
My gosh. Thank you, Daktari.
Well, thank you for being my first,
guest,
host,
on your
making
own
me so
podcast
comfortable.
and giving us so much information. Oh my goodness. I feel like I've learned so much. And now, from my understanding, maybe I don't have PMDD. Yeah.
I'm glad you've gotten there.
Yeah.
I was going to come back full circle and ask you, since you were asking for a diagnosis, where do you think you're
maybe
at?
I don't have it. And I actually don't like, what's the word? Overutilizing something I don't have. The people these days are so quick to say, oh, I have depression, oh, I have anxiety. I don't like doing that if I actually don't have it. True. So I think it's good that I've actually learned that.
Because again, from this conversation, I'm hoping a lot of people will be able to see, listen, I know I have symptoms, but on the scale of severity, I might not actually be as badly off. But it could also tell someone, listen, what I'm experiencing sounds more extreme, and therefore I should actually go in and get help.
Wow.
Yeah.
Okay.
So I'm going to say thank you
for
being
an
amazing host.
People keep telling me, actually, you should have a podcast.
Yeah,
hey,
perhaps,
guys, this might be one moment to shine.
This is the problem. Mutiny can happen. I'll just be kicked off my own podcast. And we like Dr. Hope. We want her back.
Probably not. I'm told they talk fast.
So listen, I will be calling on you if we have other conversations, and feel free to summon me again.
I will. I already have topics in mind.
Because there are lots of things I think we need to demystify for the public as well as for ourselves, because that's one of the things. I don't sit on a high horse and say doctors know everything. There's a lot for us to still learn, and as long as you're willing to learn, like what we say in medicine, the day you stop learning is the day you as a doctor die. You need to keep learning and evolving, and again reading a lot, because that's the nature of our profession.
Oh, that's true.
So,
and I may have a parting shot. Please, for us as doctors, it's much easier if you understand what's happening to you. So I really, really encourage, I don't call you patients, but watchers and people, please be proactive in terms of your health. Try and learn more about certain conditions. Like if you have a family history, it just makes the work easier for us. And also when we put you in a certain management, it's like you're more receptive. So like outcomes are just better. I love that. You know what I'll give you high pressure for? Close the episode, Daktari. Oh my gosh.
look over
High
there
pressure.
and close the episode for us.
Oh my goodness. Okay. So guys, we've come to the end of the episode. I hope you've I know you've learned. Not I hope. I know you've learned something. And if you haven't subscribed, this is the moment. So they'll put the button over here. You just bonyeza this button. Please subscribe. Please share. I think this is a very good and informative topic for women. So please share it with anyone who you think needs to hear this. And feel free to come back another time.
Thank you so much for joining me today.
Thank you for having me.
And as always, I'll see you guys on the next episode next week. And please subscribe, as well as reach out, DM, email, the usual. I know a lot of people are still shy on the comments, and I'm happy to receive all the feedback that I do. So I look forward to seeing you next week. And with that, we come to the end of this episode.